When I was in medical school, I actually thought I was going to do some sort of surgical specialty, but I really loved my time working with high acuity patients in the ICU, but I knew that I still wanted to do procedures, and there was a lot of innovation coming out in cardiology, and so it was a kind of really neat blend of some of these different things: medical care for high acuity patients, being able to stop heart attacks, still doing procedures, and then also there was a lot of new innovation coming out at the time, which was really intriguing, with things like catheter heart valves, which was a new technology. I think the thing that is most striking here is that it's not a huge center where you're one in a number. There's much more of a community kind of type of feel, and people know each other more. And Adena is such a large part of the community in terms of it's the largest employer here, that all the patients have my uncle or my brother or my mom or my friend does this, that, or the other, and so there's a real community feel here. I was lucky enough to go to some really good centers. I went to University of Cincinnati for my medical school, which is my hometown, and then I was at University of Colorado for internal medicine residency, and then after that I did 2 separate fellowships at Ohio State University in general cardiology and interventional cardiology. One of the things that we've learned from treating heart conditions over the years is that so much of prevention of heart trouble is based on lifestyle things. So what I mean by that is, trying to eat a healthy diet, trying to do regular exercise, not smoking. These are simple things that have been advice for centuries, but they really do make a big difference. I'm a proceduralist. I put stents in. I do, these different things, and those things can help people when they're having a heart attack. But the biggest thing is preventing these things. Many of the symptoms of heart attack can mimic other, common conditions, for example, indigestion. And many people feel symptoms of a heart attack in different ways. Some people feel, the classic, elephant on the chest sensation, but other people feel, sharp pains. Other people feel pains into their arm or neck or back or jaw. Some people feel just shortness of breath. Some people feel indigestion. So, there's not a great thing that we can say that, this is or isn't a heart attack. Really, the answer is, if you are having symptoms that you are worried about, that are out of the ordinary for you, you should get checked out. Particularly, if you do have risk factors for heart trouble, things like a strong family history, or if you have diabetes or high cholesterol or a smoker. These things increase your risk for having heart conditions. And so really the only way to truly know if that condition is have it evaluated, whether it's with your primary care physician, or if it's more of a sudden onset of symptoms, that would be going to the emergency room to get checked out. When someone comes to the cath lab, for example, because they're either having a heart attack, or even if it's an elective procedure, I really try to get to know that patient, even if I'm meeting them for the first time, get to know their symptoms, try to figure out what's going on, make them feel at ease and comfortable, because I understand that this is, if you're going through a heart procedure, it's an anxiety-provoking event. And so trying to help them feel as comfortable as they can, through that process is important to me.